For years, there's been this one big question hanging over the mRNA vaccines. What happens in the long run? We've all seen the short-term data, sure, but that bigger picture has always been a little, well, fuzzy. But now, a massive study, 4 years in the making, is starting to give us some real answers. So let's dive in and see what they found. And this is really the heart of the matter, isn't it? We know they were designed to protect us during the pandemic, but the question that's been on a lot of people's minds is there any kind of long-term trade-off? An increased risk of death from, well, anything? For a long time, we just didn't have the data to say one way or the other. And right off the bat, here's the headline. This huge analysis, looking at almost 28 million adults in France, found not only no increased risk of death for vaccinated people, but that their overall risk of dying was actually lower than for those who weren't vaccinated. So how on earth did they figure that out? Well, that's all in the data.
Any study is only as good as the data behind it. And in this case, the scale is it's absolutely staggering. We're not talking about a small focus group here. We are talking about a massive chunk of an entire country. Yeah, you heard that right, 28.7 million people. This wasn't some tiny sample. It was a nationwide look at 23 million vaccinated people and nearly 6 million who weren't. When you have numbers that big, the conclusions you can draw have some serious weight behind them. And get this, they followed these people for a median of 45 months. That's almost 4 years. That is exactly the kind of long-term view you need if you're going to have a serious conversation about long-term safety. So, what did all that data actually show them? All right, so let's really dig into the specifics now. This is where we get to see the side-by-side comparison. We're going to look at the mortality outcomes for both groups, the vaccinated and the unvaccinated, across a few different causes of death. Okay, so here's the single biggest takeaway. After the researchers adjusted for dozens and dozens of factors to make sure they were making a fair comparison, they found that the vaccinated group had a 25% lower risk of dying from any cause. Let me just say that again, a 25% lower risk. That's a huge difference, and it held up for the entire 4-year period. Now, this part probably won't surprise you, but seeing the numbers this clearly is still pretty wild. When you look at what the vaccine was actually designed to do, prevent death from severe COVID-19, it was incredibly effective. The vaccinated group had a whopping 74% lower risk of dying from the virus, a really clear picture of its direct benefit. But here's where things get really interesting. That lower death rate wasn't just because fewer people were dying from COVID. As you can see here, the risk was lower across the board, for deaths from cancer, from circulatory diseases like heart attacks, and even from things like accidents, which, of course, raises a really important question. Okay, but wait a minute. How do we know we're really comparing apples to apples here? Could there be some other fundamental differences between the kinds of people who chose to get vaccinated and those who didn't? This is where the study gets really smart. It's a well-known concept in this kind of research, and it's called the healthy vaccinee effect. It's basically the idea that maybe people who are more on top of their health in general, the ones who exercise, eat well, go to the doctor, are also just more likely to get vaccinated. So is there lower death rate from the vaccine, or is it just because they live healthier lives? To try and solve this puzzle, the researchers did some serious number crunching. They adjusted their models for everything: age, sex, how much money people made, even where they lived. And most importantly, they factored in 41 different pre-existing health conditions, everything from cancer to diabetes, to really try and level the playing field. But they didn't stop there. They went one step further and used a clever technique to try and account for different behaviors, like how much risk people take in their daily lives. And even after all of that heavy-duty adjusting, the result still stood. The protective effect was a little smaller, sure, but an approximate 20% lower mortality risk still remained for the vaccinated group. So let's just take a step back and put this all together. After digging through 4 years of data on nearly 28 million people and controlling for just about everything you can think of, what's the bottom line? What does this really tell us about the long-term safety of these mRNA vaccines? I think the authors of this study really said it best, so I'm just going to read their conclusion directly. They said, these national-level results found no increased risk of 4-year all-cause mortality, further supporting the safety of the mRNA vaccines that are being widely used worldwide. I mean, it doesn't get much clearer than that. So what this all boils down to is pretty simple. While no study is perfect, the sheer size and length of this one points in a very clear direction. The idea that mRNA vaccines are secretly causing more deaths in the long run? Based on this massive dataset, the researchers say that's highly unlikely. And that leaves us with a much bigger question to chew on. This study is about more than just one vaccine. It's a powerful example of how we can use huge, real-world data to get answers to critical safety questions. So as new technologies come along, are we going to be able to use this same approach to understand them with this kind of speed and confidence? It's definitely something to think about. Thanks so much for joining me.